Okay, so let's talk about muscles of mastication. So mastication is just a fancy term for chewing. So mastication, hey, we have our temporalis up here, and actually in the previous picture, so you have the temporal parietalis covering it. But when you cut it back, then you can see the temporalis. This is more inner. And then you have the masseter. So remember that masseter comes from, actually masseter and mastication comes from that same Greek word meaning to chew, or was it? Yeah, I think it was Greek. So masseter, or the other way I like to think of it, I like to mispronounce it in my mind and pronounce it masheter. So I'm thinking like mashing my food, mashing it into mashed potatoes. So I think the masseter is mashing your food and chewing. Now the other two, so you know temporalis attached to the temporal bone, masseter involving chewing. Now you have the lateral and medial pterygoid. So one is more to the side, one is more to the middle. But where does pterygoid come from? So it comes from this bone right here. Hey, the sphenoid, right? And then there's some part on the sphenoid that's called the lateral and medial plate. That's part of the pterygoid process. So this is another landmark you should know. So the pterygoid muscles come from the pterygoid process. I remember how I talked about like bumps and projections versus holes and grooves. Remember, whenever you have some sort of bump or ridge in a bone, typically something attaches to it. In this case, this is a great example of how a projection or some sort of protrusion in the bone helps muscles to attach to it. So here I like to think of it. So remember that the sphenoid is a winged bone, right? So it has a greater and lesser wing. So I like to think of it as a pterodactyl. And the little feet of the pterodactyl, these are the pterygoid processes that contain that attach the pterygoid muscles. So there are only four main muscles of mastication. These are the prime movers: the masseter, temporalis, lateral pterygoid, and medial pterygoid. So often a common mistake is like saying the buccinator or orbicularis oris. They help with chewing. They're more like accessory muscles that kind of help to keep your food in your mouth, but they don't actually assist with that elevation and depression and that kind of mashing movement with your jaw when you chew. So these are the primary movers of mastication. Only four. I think that's a really doable list. And let's see. So here we have abdominal muscles. And actually, let's go back a bit. Let's go back to top hat because we did cover abdominal muscles last lecture. So let's go to the next top hat question. Well, not just abdominal, but let's talk about superficial trunk and abdominal muscles. The pectoralis major. And if you're a gym rat, I hope you get this correct. If not, I don't know what you're working on. Okay, let's see the responses. So most of you clicked here, and yes, it's major. Some of you clicked the deltoid. This is the pectoralis major. So again, that's why you see a lot of people doing a lot of push-ups and bench presses. They're trying to work their pecs here. Okay, and then next question. Click on the yellow square highlighting the external oblique. So remember, internal versus external. Which is out, which is in? And oblique, we did cover this last lecture. What does oblique refer to? Okay, let's see how everyone did. So some of you clicked here, some of you clicked here. Now they are both oblique. It's because why? Because oblique means kind of like an angle to a slant. So these are kind of slanted, but this one right here, nope, this is going parallel to the long axis of the body. That's incorrect. But which is external, which is internal? So this is a big hint right here. Notice that there's a big cut. This isn't natural in your body. This means this poor person's abdominal has been cut here. So now we're actually looking on the inside. So which is on the outside? This part that's intact or this part that's on the inside? So this part is out the external oblique because again, it's at an angle, but it's also external. And when you're doing so this is another thing to watch out for on the exams and questions is that these cuts are important because are you looking on the inside or are you looking on the outside? If you don't know pay attention to where cuts are, then you won't know if you're actually being superficial or deep. Okay, now it's working. So hopefully everyone gets that correct now. Now highlight the internal obliques. That little review on oblique muscles and internal versus external. All right, let's see how everyone did. And okay, again, remember, click on the inside the square, or whoever cut here. And then also this, again, these aren't obliques. These are going straight up and down. So these are not oblique. So then again, what we have here, these are also at an angle you can see here, but these are internal. So most of you did get it correct. I think there's one more question. Oh, okay. I know some of you are eager to get at this, but click the rectus abdominis, or click the yellow square highlighting the rectus abdominis. Don't just click randomly. Like if you click outside here, you're not going to get it correct. So yeah, obliques no longer the name. Now it's rectus. Okay, so rectus abdominis. Again, click inside the box right here. And most of you are correct. So again, this is the rectus abdominis over here, and it's going up and down. So remember that rectus is a cue, or it's a terminology that, like I think, was it in the open sacs, it says when you rectify a situation, you straighten it out, or when you erect something, you put it up, straight up and down. So the thing is that this is the rectus abdominis. It goes along the axis of the body. All right, so then let's go back to, oh shoot, it's already 2, man. Okay, so the thing is that what I'm getting at here is that a lot of people, I notice that some people are just zooming straight here on the abs. As like they want, when you think abdominal muscles, this is what the layperson and most people think of. You think of the six-pack. But what I'm getting at here is that your abdominal muscles and all the ones that over here, you have more than just your rectus abdominis. You also have multiple layers. So what you have is your external obliques on the outside, your internal oblique, or relatively on the outside. The most superior of those layers on the sides. You have your external obliques. And this image is a little confusing because it looks like the transversus, like just by order, it looks like it's in the middle. The internal obliques are immediately deep to the external obliques. And then the innermost is the transversus abdominis. So you actually have not just like your obliques. Sometimes you just call it the oblique muscles, but you actually have 3 layers of muscles on your sides, not just that rectus abdominis in your anterior and front. And ooh, what happened there? Okay, so what happened? Ooh, okay. So take it from the thing is that the transversus abdominis, you couldn't see that in the previous picture. Okay, now PowerPoint's bugging. Yeah, so then you couldn't see the transversus abdominis in that previous picture. So what I'm getting at here is that you have multiple layers of muscles, multiple forming your abdominal core. It's not just your rectus abdominis. That's why, like, you might see abdominal routines. They twist it all different angles, all different movements. Well, you're trying to hit all of those different layers of your abdomen at once. Or not at once, but during a workout. Okay, so to review, put these muscles in order. So just 3 layers. So this is the most popular order, and this is the correct order. So again, there are multiple layers to those lateral muscles to the sides of the rectus abdominis.